So everybody is recommended to get the vaccine for COVID-19. And if you've had COVID-19 before, you're still eligible. In fact, the vaccine will be very helpful for you. It's important that when you get the vaccine that you don't have any symptoms lingering from the disease that you had, and that you're fully recovered, and that you're no longer required to be in isolation. At that point, you can make an appointment to get the vaccine, and it would be very important that you do so. For the two-dose vaccines, the science shows that after one dose, you do get reasonable protection, but that's not going to last forever. And the vaccines are designed to be two-dose so that the second dose is able to boost the first one that you received. And even if you have had COVID-19 in between that first and second dose, you should still get that second dose, but the timing is important. You should not be getting the second dose if you have any symptoms for COVID-19, if you haven't recovered. And it's got to be at least 10 days after you first had symptoms in order for you to be able to go out, make the appointment, and get the vaccine. For anybody who feels like the process of getting the vaccine out to the public feels rushed to them, the science behind the vaccines weren't rushed at all. The trials were conducted under rigorous standards and were evaluated at each step to the point where everybody was comfortable that these vaccines are safe and effective. Yeah, I'll say that I always think about the source of that information. I like to go to the original source and just do an evaluation whether or not that information is coming from someone I can trust, someone who has my interest at heart. And if it feels like that information is too pushy, or it's trying to convince me of something that seems more important to them than to me, my guard goes up, and I think maybe I need to talk to an expert about the questions I have. A healthcare provider is a great place to start, and certain websites like the CDC, the local health department, the state health department have very credible information on there, and they keep it up to date. Yeah, a real danger of these myths spreading in our society is that they really prevent people from making informed health decisions. That when people get bombarded with information from all different sides, different sources, and they conflict with each other, what is a person to do? And it's important that everyone sort of stay focused on what are the facts related to COVID-19 and vaccination, and people who are in search of information should go to credible sources and be focused on just that.